Your vaginal discharge can reveal a lot about your body. Stay tuned to find out more. Hi everyone, I'm Dr. Michelle, Medical Director at Ezra Clinic, and we are a women's health and wellness clinic. Common vaginal symptoms that should prompt a visit to a doctor includes abnormal coloured discharge, such as yellow or green discharge that is associated with itching, abnormal odour, or other symptoms such as vaginal swelling, discomfort, or pain. So the difference between normal and abnormal discharge. It is normal for some women to experience some clear coloured or slightly whitish discharge as is just part of the vaginal health. However, abnormal symptoms include any abnormal colour, any abnormal odour, itching, abnormal amounts of discharge, or experiencing discharge for prolonged periods of time. Abnormal vaginal discharge is a symptom of vaginitis. Vaginitis simply refers to inflammation of the vagina, and this can be caused by problems such as infection or inflammation. If you experience any of these abnormal symptoms, it is important to see a doctor early, as I have seen in my practice many women who try to use home remedies or buy over-the-counter medications to treat their symptoms, and however this ends up worsening the problem, it also ends up taking a much more prolonged period to treat the problem. It is also important to rule out other more serious underlying causes of your symptoms, such as sexually transmitted infections. So other symptoms to look out for include things like prolonged period of symptoms that do not go away despite already trying some medications. Other abnormal symptoms can include abnormal bleeding, for example, bleeding when you're not on your period, bleeding after intercourse, or abdominal pain or fever. So when you visit a doctor for symptoms of abnormal vaginal discharge or vaginitis, we will typically take a thorough medical history. This will include potential sexual history as well. The doctor will then proceed to do a physical examination, and we typically recommend performing some swab tests as well to facilitate in our understanding of the underlying cause of the condition. This also allows us to rule out any underlying serious conditions that could be the cause of your abnormal symptoms. Subsequently, we will also prescribe some medications for symptomatic relief, but when the medical report comes back, the doctor will then be informed on how to tailor the treatments accordingly to best suit your condition. It is important to understand that these symptoms of vaginitis or abnormal discharge are extremely common in women, and there is no need to feel shy or hesitant to see a doctor about it. Perhaps something that could be helpful will be to see a female doctor to provide a safe environment to make it less daunting for you to seek medical treatment for this. So if you're experiencing any of these symptoms, don't hesitate to see a doctor as soon as you can.